points are very important from the bronchiectasis. Number one is the permanent and other is the dilation. So bronchiectasis is actually the permanent dilation of bronchi and bronchioles that are caused by destruction of smooth muscles and supporting elastic tissue. So the number one major cause here we have is the chronic necrotizing infection. So believe me, bronchiectasis is not a primary disorder. It's actually a result of another disease. Okay, so it's a secondary disorder. Next are the major symptoms is one is cough and other is the copious amount of sputum that is produced. So the diagnosis is mostly based on the history and radio findings. So let's first discuss the predisposing conditions before discussing the pathogenesis. So number one, here we have bronchial obstruction. The obstruction can be caused by tumor. It can be caused by a foreign body that is impacted at some point, or it can be caused by infection of mucus plug. But believe me, if there is obstruction of right upper bronchus, so the area of bronchiectasis will be localized. It's not diffuse. Now let's discuss some congenital or hereditary conditions. Number one, here we have cystic fibrosis, and it's an autosomal recessive disorder in which there is defect in the chloride channel. But here, in case of bronchiectasis, there is abnormality in the action of ciliary mechanism. So as a result, there will be accumulation of mucus, and the accumulated mucus will be prone to infection. So cystic fibrosis causes widespread bronchiectasis. Next is immunodeficiency. It can cause localized or widespread. Next, here we have primary ciliary dyskinesia. It's an autosomal recessive disorder, and there is immotile. The cilia abnormalities occurs in this condition, and it's also known as immotile cilia syndrome. And when there is ciliary abnormality, then the clearance of mucus will be impaired, and as a result of impairment of clearance of mucus, there will be accumulation of mucus, and it will be predisposed to infection. Next are the necrotizing or suppurative infections, that is Staph aureus, Klebsiella pneumonia, and post-tubercular infections. Now, next moves towards the pathogenesis. So, there are two conditions. One, the pathogenesis starts from obstruction, and other is when it starts from infection. So, if it starts from obstruction, let's suppose that there is a bronchus and there is obstruction occur at the beginning, and because of the obstruction, the mucociliary mechanism will be impaired. As a result of impairment of that mechanism, there will be impairment of clearance of mucus, and if the clearance of mucus is impaired, then there will be accumulation of that mucus. As a result of accumulation, collection of that mucus, that will be a favorable site for infection. And if there is an infection, then the inflammation will also occur. And if there is inflammatory damage, then there can be exudate formation, and that exudate will going to take that space and will cause permanent dilation, irreversible permanent dilation of bronchi or bronchioles because of damage of elastic tissue and smooth muscle. Next, let's move from the chronic infection. So if there's in the beginning there's an infection, and if there's an infection, then there will be inflammation. Because of this, there will be impairment of the mucociliary mechanism, and if there is impairment, then there will be accumulation of mucus, and that is going to cause obstruction, and there can be fibrosis occur around the bronchioles. So that also contributes towards the bronchiectasis. Now let's move toward the morphology. So mostly the lower lobes are involved bilaterally, because here the air passages they are vertical, and if the most distal parts are involved, then it's mostly severe. Okay, and the airway dilution that actually occur is 4 times than normal. So in case of if we observe them grossly, so the bronchi they are that much closer to the pleura that they seem that they're normally not visible there. So next, if if it's active and it's in the full-blown condition, so in that cases there will be desquamation of the epithelium and ulceration can occur. And if healing occurs, then the epithelium, it can regenerate, but there are fibrosis. There is chances of fibrosis occurring. So fibrosis occurs in the wall, or peribronchial fibrosis occur in chronic cases. So walls can also be necrosed and they can be liable to abscess cavity formation. And now the clinical features. So, you know, cough, severe persistent cough, sputum, mucopurulent sputum occurs. Okay, dyspnea, sinusitis, and hemoptysis, they can occur. Okay, and in case of severe and widespread bronchiectasis, the features are similar to that of obstructive diseases. And so there will be decrease in the pulmonary functions and hypoxemia, hypercapnia, increase in the carbon dioxide, and pulmonary hypertension that can lead to cor pulmonale, the right sided heart failure. So, but because of the current treatment, there are improvement in the complications that used to occur in past. So that's all about bronchiectasis. If you like this video, click on the like button, and also thanks for watching this video. Please subscribe to the channel. Thank you so much.